everyone, this is Suprabha. Welcome back to another session with me. In today's session, we will be discussing about Guillain Barre syndrome. So here in Guillain Barre syndrome, what happens? There will be acute paralytic polyneuropathy. So acute means there would be sudden onset, and also paralytic means there would be ascending weakness. So how this weakness will be present? This will be symmetrical. That means in both the side it will be similar. And then there would be polyneuropathy. So polyneuropathy means it would it would affect the peripheral nerves. So basically there would be paralysis which would be symmetrical, and also there would be polyneuropathy. That means it would affect the peripheral nerves, it would damage the peripheral nerves. So let us see the meaning of Guillain Barre syndrome. So Guillain Barre syndrome is a collection of clinical syndrome that manifests as an acute inflammatory polyneuropathy with resultant weakness and diminished reflexes. So basically it is a collection of clinical syndromes. That means there are several syndromes which would manifest as an acute inflammatory polyneuropathy. That means the peripheral nerves would get damaged, and also along with that there would be resultant weakness. That means paralysis, right? What we already saw, that there would be it is a paralytic syndrome also, right? So there would be paralysis which would be symmetrical, and also along with all these things there would be diminished reflexes. So if we see the classic presentation of Guillain Barre syndrome, then it is characterized by an acute monophasic. That means it would be recurrent. So the illness would be recurrent. That means the symptoms would would be recurrent, and also there would be several episodes of this illness. And it would be non-febrile, which would manifest as ascending weakness and areflexia. So that we already saw, right, that the paralysis, what would be present, right, it is a paralytic neuropathy. So the paralysis would be symmetrical, and also it is in an ascending manner, right? So there would be ascending weakness and also areflexia. Next, moving on to the pathogenesis. So here we would try to understand how does it happen. So for example, let us assume that there is some infection. So maybe infection with Campylobacter or with cytomegalovirus, right? So when there is an infection in the body, what would happen? The B cells would create antibodies against that pathogen, right? So this is a normal mechanism that we can say, right? So whenever there is an infection, our immune system would produce antibodies to fight against that antigen. Now here in Guillain Barre syndrome, what happens? There would be molecular mimicry. So what we mean by molecular mimicry? Now the antibodies which are produced by the B cells, these antibodies also matches the protein on the nerve cells. So if the antibodies matches the proteins on the nerve cells, then what would happen? These antibodies would may also target these the proteins on the myelin sheath or the axon. Now if the antibodies target these proteins, then what would happen? There would be damages to these nerve cells, right? So this attack leads to damage of the nerve cells, and which leads to neuropathy. Next, moving on to the clinical features. So in clinical features, the first major thing that we can notice in these children would be weaknesses, because there is we have already seen that there would be acute paralytic neuropathy, right? And we just now discussed that how this neuropathy will happen, right? So here the first major thing that we can notice would be weakness. And what would be the onset of the weakness? So it is basically gradual and it progresses over weeks. So we have already mentioned that this will be ascending weakness, right? So it would start from lower extremities. So the child would be unable to walk, the child would refuse to walk, basically the child won't get strength to walk. And then from the lower extremities, it would it would progress over time. So it would move to trunks, and then gradually it would move to upper limbs and then bulbar muscles. Also there would be flaccid tetraplegia, and there would be muscle tenderness. Also, along with all these things, there would be, onset of paresthesias, or in some cases, we can also, find out areflexia. Also, there would be dysphagia and facial weakness. And along with these things, also there would be, it would interfere with eating, and it would increase the risk of aspiration. So as you can understand that, this is an ascending weakness, right? And over time, what would happen? The facial muscles would also get, it. So as you can understand that, there is an ascending weakness, right? So over time, what would happen? The facial muscles would also become weak. And that's the reason the child will have difficulty in swallowing. And also, there would be interference with eating. And there would be increased risk of aspiration. And apart from these things, there might be postural hypotension or profound bradycardia, and occasional asystole, or urinary retention or incontinence. Next, moving on to the courses of the condition. So here the first phase is initial phase, which increases gradually, and the involvement lasts around 10 to 30 days. So it is basically less than 4 weeks. And then there is plateau phase. So plateau phase is a very short phase, and it finished within 2 weeks. So if it lasts longer than that, then there would be poor prognosis. And then there is recovery phase. So recovery phase occur within months. Next, moving on to the investigations. So in investigations, the first thing that we can do would be lumbar puncture. Now, through lumbar puncture, we can get to know if there is elevation of CSF protein, or if the cell content of CSF is normal or not. Next, we can do electromyography. So this is to assess the muscles and the nerve cells, right? And here the nerve cells are damaged, right? So what we can understand through electromyography, so the motor nerve conduction velocities would be, it would be greatly reduced. And if we see the sensory nerve conduction time, then it is often slow. Also, there would be evidence of acute denervation of muscle. And next, we can also check serum creatine kinase, whether it is elevated or normal. And apart from all these, we can also do muscle biopsy. So if it is in early stages, then the muscle biopsy would appear normal mostly. But in chronic stages, it can show if there is denervation, or if there is atrophy. Next, moving on to the treatment. So here, in treatment for pediatric patients, the most effective form of therapy is generally considered to be the intravenous immunoglobulin. Now, how does this help? Because we already know that, there are harmful antibodies which are attacking the nerve cells, and because of that, there is, the nerve cells are getting damaged. So there is neuropathy, right? So that is why this immunoglobulin is provided. These are healthy antibodies which would, stop this harmful effect with whatever is going on. So that is how it helps. And also plasmapheresis can be used. So what they do in plasmapheresis actually, so basically there would be, they would remove the plasma of certain antibodies that contribute to the, immune system's attack on the peripheral nerves. So that's all about the treatment. Now let us move on to the nursing management. So here the nursing management is basically, the treatment what we provide for Guillain Barre syndrome is actually non-specific, and it is a symptomatic management, right? So what are the nursing interventions that you have to consider? So the first thing would be you have to observe the child continuously for adequacy of respiratory effort. So as we know that there would be muscle weakness, right? There would be paralysis, there would be neuropathy, right? So you have to continuously observe the child for the adequacy of respiratory effort, and there should be continuous ECG monitoring. So apart from these things, if there is prolonged flaccid paralysis, then that would lead to muscle atrophy. So in that case, the child would require rehabilitation and physiotherapy. So you have to make sure that if there is prolonged flaccid paralysis, in that case physiotherapy is provided to the child. Next, moving on to the complications of Guillain Barre syndrome. So the first one would be weakness of the respiratory muscles. So that is one complication, and the second one is autonomic instability. So the nerves which actually control the non-voluntary body functions, for example, blood pressure or heart rate or, sweating, these nerves also might, start to get damaged. So that is again one more complication. Well, that's all about today's lesson. So let us conclude our today's topic here. So today we learned about Guillain Barre syndrome, right, which actually says acute paralytic neuropathy. So there would be sudden onset of this paralytic neuropathy, and the paralysis which will be present, it would be symmetrical, right, and there will be an ascending weakness, and also there would be, the peripheral nerves would get damaged, right? And then we learned about the pathogenesis. How does it happen? So basically what happens in Guillain Barre syndrome would be molecular mimicry, right? And then we learned about the causes of the disease and the clinical features, and how to, what are the investigations that should be carried out, and also what is the management, right? So I hope you've got a better insight about the topic. Thank you.